have to run that tape around and attach it to the back of their leg, like around their hamstring tendons, around their medial hamstring tendons. And I just have a hard time getting to that spot if I don't have enough gap back there. So I tend to tape them here. I'll show you how I position them, and we'll show you here what we're going to do. Okay, fundamentals of taping. I'm sorry I don't have a sheet. Can I borrow somebody's really quick? So basically you want to make sure the skin is clean, dry, that there's no irritation, that there's no lotion on the skin. We use like an alcohol or just water and soap and wash off their skin. You know, if they're real, the tape will not stick as well. We use a lot of times a tape, a tape adherent. And here, I'll switch it and see if you can get the one you've written on. I use a tape adherent that is like a tacky sort of thing. I don't know if you guys have ever taped anything, but it's a tacky adherent that helps the tape stick better if they don't have a skin irritation, especially if they're going to wear this for this stuff. It can stay on. You can shower with it on. That type of thing. I don't recommend, you know, showering, swimming with it that much, but it's not too bad. Usually it'll last a day or two. Sometimes I have patients that are taped their foot and they keep it on for 3-4 days because it feels really good. I don't know how effective it is, but hey, as long as their skin's not being irritated, they can leave it on for a few days. Also, if you do use ice on the knee and then you're taping them last after that, make sure the skin is a little bit warm, that it gives a chance to warm up. I just, you know, let them sit for 5 minutes then and warm up, or 4 minutes or something and let them warm up, so that you're not taping on cold skin, okay? Anything else here? No, don't apply it on damaged skin, blah, 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 all that good type of stuff. Tape should be free of wrinkles. You really want to anchor the tape to the skin for the best resistance. That's particularly true if you use a pre-wrap. Have you guys seen like that pre-wrap, that under-wrap that goes under? White tape sometimes, if you use on athletes. Definitely if you're using that type of tape, you want to tape directly to the skin. This type of tape, we put this cover roll underneath it, because if you put this Leukotape, some people use this directly on the skin, it can tend to have a very irritating effect on the skin. So usually we put this cover roll underneath it. Removal of the tape. If this has been on for a few days, this tape gets very adherent, it gets very tacky. So don't rip it off like a Band-Aid. You really want to make sure that you tell the patients this, because if they just go ahead and just rip it right on off, they can tear their skin, okay? So that's not feel real great, and they'll not be real happy if they come back, okay? So you can use a tape remover solution or get them in the shower, you know, make sure that they just kind of peel gently. Peel the skin away from the tape versus the tape off the skin. Make sense? Alrighty. I hope I covered everything there. If I didn't, there for your beneficial reading. Okay, scoot forward into these chairs. There for me. Okay, so what I do is I straighten there. And nope, I'm fine there. So I tend to straighten them out. I don't want them in hyperextension, but I want them in a fairly extended position. Just a tiny, minimal bend in the knee. Okay? Because I don't want them in straight extension. We don't function in straight extension. And you're going to tape them in this position. So the way you're going to do is you're going to look at the alignment of the patella, okay? When I look at patellar alignment, I don't want to just go, oh, you know, that looks pretty good to me. You really want to feel the borders of the patella, okay? So especially if they've got a swollen kneecap, or if they just are one of those people that have a little extra tissue around their kneecaps, you want to make sure that you actually are finding the correct patellar alignment, okay? And I want to look, you know, like directly on it. So I would be like basically in front of them, okay? So if you look at Sue's knee here, anybody notice that it's like really shifted one way or the other, or does it look pretty neutral to you guys?
I'll go with neutral.
I don't know. Okay, let me show you here where the borders are, and maybe that'll help you guys out, okay? So I'm here on either side.
Lateral.
It's a tiny bit lateral, I would say. Just, you know, maybe a little bit, not excessive, but most of our kneecaps are shifted, like laterally, you know, glided a little bit to the side, and a little bit of a lateral rotation. That's the usual position. You'll find some people that you can really feel underneath this lateral border. So first of all, I look at the alignment centrally, you know, right or left, okay? So it can either be laterally shifted a little bit. You rarely find that it's medially shifted, okay? So it can be shifted right or left, a little bit medial or lateral. Usually lateral. Then I'm going to look at the tilt of it, which means if I look at the patella this way, is it tilted laterally this way, or is the lateral border tilted up and it's tilted medially? Once again, you're going to find that most patients are tilted a tiny bit laterally. So I name it by the direction it's tilted. That means the medial border I can palpate the medial border this side a little bit more than I can palpate underneath this side, and that's true. I can palpate underneath this side just a little bit easier. I can get my finger underneath there. Some patients, you can really get your fingers underneath there. You can really feel underneath that, and they are really medially tilted, okay? So what I want to do is I want to tape the opposite directions, okay? Because if she's shifted this way and she's getting a whole bunch of knee pain, I want to tape her into more of a neutral position, okay? So the way you do this is when I tape it, if I'm going to drift it over this way, I obviously want to pull this direction, okay? So I take the tape here and I'm going to align it to see what I need. I'm going to wrap this and extend this tape around past the medial hamstring tendons, okay? So all I'm doing here by aligning it here is just measuring, basically, see how much I need, okay? There's some nice, lovely little lines on here so you can kind of like figure out which line you're close to and just cut that appropriately wherever you feel it is, okay? And I will usually do 2 strips, okay, just because this stuff is very expensive. I'm just going to show you 1 strip, and if you guys can just don't mind using 1 strip in the clinic, that would be, or as we're practicing, that would be wonderful. I fold it, because when you rip this backing off, it likes to roll on you and misbehave itself, especially if there's a lot of static in the air, okay? So it really misbehaves itself, and once it folds on itself, it's pretty nasty to try and now separate apart, okay? So I just fold one side of it like that, and I'm going to peel the opposite side off, like this, and I'm going to peel this side off like this, and we'll see if we can get it to behave itself. Okay? See? It likes me. So, I'm going to just be like this, and I'm going to keep all the wrinkles out as much as I can. I'm going to start, and I want this to go centrally across the kneecap, okay? So I have to kind of figure out where that is. So I want it to lie like right across here. I don't want to put it down here, I don't want to put it across here, because I want to tape it evenly.
And if you were using 2, would you go?
I would go like 1 a little bit here and then 1 do there, and I would overlap them by at least, a half, okay? So that's how we would do 2 of them. Just because you can cover a little bit more surface area, and then you can make sure that this Leuko tape, it's called, is the tacky stuff, the brown tape, you can make sure that never lies on the skin then, okay? And then you just have a little bit more room to play with. So once again, I kind of look for that neutral, hopefully that goes to there. And I want to make sure that I started out enough here that I got enough that I can pull from, and then I'm just applying that right across here. And I made this a little tiny bit too big, but that's okay. And I just once again want to make sure I don't have any wrinkles in there. Yeah, I'm going to wrap that right around.
So you're not putting any tension, right, on
Nope.
the first?
This tape does nothing, okay?
It's just the protection.
It's just a covering strip, okay? So you do not have to put any tension on it. That's why you want as little wrinkles as possible as you can get into it, okay? Because you want it to be flat so that the tape you're applying over it doesn't, lie abnormally, okay? Your second strip of tape then is this Leuko tape stuff, okay? Pretty tacky, pretty sticky. This is cheap stuff, so it's not as nice. Kind of cheap stuff. Sorry, guys. It's, I don't know, some off-brand of Leuko tape. Not the true stuff. We do have some true stuff here. So this is going to tear pretty easily, I have a feeling. So once again with this tape then, this is the one that I'm actually going to be applying the tractioning force with. The nice way to measure this, if you do not know how to do it, is just to kind of put it here, and then you can measure how much you need, okay? And then usually I will put it on the edge of the table to cut it, because it sticks right, there. And I'll usually do 2 strips of this as well. So I'm going to take it here, I'm going to make sure I'm aligned in the middle of her patella, okay? I'm going to start this out on the lateral side, and what I want to do then is I am going to glide the patella medially, because it sits laterally, okay? So I'm going to take my thumb here. You want to make sure the patient is relaxed. If they got their quad contracting, can I move the patella? No. Okay. So they should be relaxed. That's why you don't want them in full, hyperextension either, okay? So she's relaxed. I am gliding over, and I am taking up all this soft tissue here, and I'm going to pull that and I'm going to create wrinkling underneath here, okay? So I'm going to wrinkle that up. Usually I'm over on this side, too. So I'm pulling this way, and I'm gathering up all this soft tissue. There we go. Thank you. Just changing positions. And then I'm going to run this underneath here. Now, I have to make sure, too, that if I cut it a little bit too long, I'm just going to tack this down. But I want to make sure that I'm not on her skin then, okay? So that's going around. See how there's this wrinkle in here? You want that. You want to have a wrinkle here. You want to have this dimple, okay? So all I'm doing is I'm gliding with this hand, I'm gathering up the skin, I'm creating a wrinkle in there, and I'm tacking it down, okay? So I'm just producing the medial glide. And then I would usually use 2 strips for that.